I'm Anna. I'm going to be your student nurse today. I'm here to just do some trach care and suctioning. I'm going to put this down on a clean surface over here, and I'm going to just do some hygiene really quick. I'd like to start by just asking your first and last name as well as your date of birth. I'm going to double check your ID band. Perfect. Thank you for that. Do you have any allergies before I proceed? Okay, well, per your physician's orders, I am here to just do some trach care and suctioning. It shouldn't take me longer than about 15 minutes or so. This is again just to kind of keep your trach clear, secretions, try to prevent infections. Do you have any questions before I begin? No. And then do I have your verbal consent to continue with the procedure? Perfect. So I'm just going to make sure I give us some privacy though during this. I'm going to just get a few things set up. I want to raise you up though to a better working height for me. I also want to make sure that, well, let me do some hand hygiene one more time before I'm touching your bed, just to be on the safe side. I'm going to raise you up to my hip level. I would also want to make sure that your head of the bed is at a semi-Fowler's or Fowler's position. Let's see, so. And it looks like I am about 45 degrees, maybe a little bit higher to keep it. Perfect. Perfect. And I would make sure that I have a pulse oximeter on you because I just want to monitor your SpO2 throughout this procedure. I am also going to take my stethoscope and I'm going to take a quick listen to your lung sounds before we proceed. I am hearing some adventitious sounds, and I am hearing some kind of secretions in your trach, so I do think it would be beneficial to suction your trach at this time. I'm going to just lay a towel down across your chest in the event there's any type of secretion, splatter. Okay, so I'm gonna lay that out. All right, perfect. I do have an ambu bag just in the event of any emergency, or bag valve mask. Okay, I do have your oxygen set. I'm going to hyperoxygenate you per our facility's protocol. So that would either be with the ambu bag, or for our policy, we are able to just raise up our oxygen level. Okay, to just hyperoxygenate you. I'm going to right now just put on my own PPE. I think I might keep it. Let me just do PPE one more time just to be on the safe side. And it's always better to be clean. So I'm going to put my gown on first. And do let me know if you have any questions as I'm continuing along, or any concerns. Tie myself back here. Alright, so I'm going to put my face mask on with my shield to kind of protect myself, just in the event of any type of splatter. Right, I'm going to do hand hygiene one more time. And I do have a garbage can here in the event that I need to dispose of anything. So at this time, I do have you at my level of my hip. I do always check that this is not expired. Open this up. All right, so this is just my suction catheter tray. I will try to pull my gloves out. So based on the kit that we are working with, I do need to pull out my gloves first. I'm going to just put on my dominant hand first. They're a little bit stiff. Not touching anything. Oh boy, sometimes the paper just gets really stiff here. Okay, so I'm going to take my non-dominant hand, it's going to pick up my dominant glove. Just going to place that on. Slightly out. There we go. And I'm going to take my dominant hand and I'm going to pick up my suction catheter, and I just want to place that on here so that way I can take my non-dominant hand to take my solution. Again, I always want to check expiration date on it. I can put my cap face up. I still have view of my whole field. Label will go into the palm of my hand. If this bottle was ever open before, I would have to lip it. This bottle was not open before, so I do not have to. So I'm going to pour my solution, making sure not to splash. And come over here. And go ahead and just replace my lid because I shouldn't need any more. Now I can put my other glove on, my non-dominant hand. Okay. And again, the only way I can fix is anything that wouldn't touch or contaminate. So now I want to take my sterile hand. Actually, both of these are still sterile right now. So I can pick this up. And what I want to do right now is just coil this around my dominant hand so that way my non-dominant can come over to my regulator and make sure that it is not going to exceed the 120, which it kind of is. Okay. So have it set to about 120. So I can take my suction tubing over here, attach it to my catheter, and then my non-dominant hand is going to be the one controlling the valve over here. My patient is still being hyperoxygenated. I can test my catheter though by applying the suction, and it does work. So now again, between any attempts, I can coil this so I can make sure I maintain its sterility. I'm going to just move the oxygen mask over to the side so I have access to my patient's trach. I move this down just a little bit so it doesn't get in the way. And what I should have done, and I can still do, because this is technically dirty, I can lower this rail, but I should have been smart and did that for myself earlier. But what I'm going to do is take my non-dominant hand, is going to be off of the suction on the way down. I'm going to insert the catheter into my client, and I'm going to make sure that I stop when my patient chokes or hit resistance. So I'm going to place the catheter in. So I'm going in, I hit resistance. So I'm going to pull back about a ½ inch, and then I'm going to make sure to apply intermittent suction on the way out. And I make sure that I'm not down there for longer than 10 to 15 seconds. And I want to assess my patient's respirations, their pulse oximeter, to make sure they're not in any distress. Between any attempts, you can apply their oxygen back on them. I'm going to make sure that I wait about a minute before doing another pass. During this time again, I have assessed respirations, their pulse oximeter, and I am listening for any audible secretion still. It appears as though we still need to do one more pass of the suctioning. So I'll say a minute has passed. I'm going to move the trach collar to the side. I'm going to unravel this here for a second. And again, I'm going to go down, making sure I'm not putting any suction. So I'm going to go down. Without applying suction, I hit resistance, so I pull back a ½ inch, and then again I'm kind of doing like a circular here, applying intermittent suction on the way out. And again, I can reapply my patient's oxygen, make sure that they are stable. I am hyperoxygenating them at that point still, in the event I needed another press. It does appear that their respirations are within normal limits. Their SpO2 is stable, so I do not think we need to proceed with any more suctioning at this time. So what I can do is turn off my suctioning. I can place that, and I'll lower them back down to their recommended or their ordered. I would discard of my catheter in the appropriate receptacle. I'm going to make sure that I'm going to be proceeding into my trach care at this point. Sometimes, again, we don't need to do trach care at the same time, but as it is ordered, I'm going to remove this. I'm going to remove this drape. There was some kind of contamination. I'm going to toss that. I'm going to take this moment to remove the fenestrated gauze here. Put the split 4x4. And again, I'm just looking if there's any like drainage. So I'm looking at the color, amount, consistency, odor. Perfect. In the appropriate receptacle, I can also toss out any of my other items here. I would toss this all into the appropriate receptacle. Okay, so then now I can take off my gloves and do my hand hygiene. I'm also going to lower this rail since I did not do that on the first one, just to help myself gain a little bit of closer access to you. I do have my inner cannula that I'm going to replace, and I also have my tracheostomy care kit. So again, these would be fully sealed if this was, again, a new kit. I do have my solution still available here. Make sure that I have my garbage within reach here. And I do want to now do hand hygiene. And again, if you're in any discomfort, please let me know. Okay, so I'm going to open up my kit. At this time, I'm also going to open up my Shiley. Hopefully this will stay open for me because I will be needing to grab that. What I will need to do is my orders call for, I'm going to place the drape, trying to touch only the outsides here. I'm going to place the drape on my client, only touching the border. Again, shiny side should be down. And just lay that just as kind of an extra little protection there. I will have to pour solution into my container. So again, this has been used now like earlier when I was doing the suctioning, so I'm just going to pour, making sure I stay above my waist level there. Both of my hands are still not sterile, so I can pour that into my container. Take this. And so my kit does not come with a drape that then would be able to go down here. So I'm going to see if I can do this without turning my back. One more hand hygiene, just to be on the safe side. And then I'm going to take my non-dominant hand to pick up the glove of my dominant hand. I'm going to, hope I saw where my thumb is. I'm going to place that on. I'm going to slip my dominant hand in there. Looks like these are backwards, so we're gonna see how well I can do. Oh, look, we're good. Thought it was opposite. Okay, so now I do have, again, I am a right-handed person, so my right hand is going to be my sterile hand. My left hand is my non-dominant, or therefore not sterile. At this point, I can commit this to being not sterile, but actually before I do that, just in case I have to touch anything in here, I do want to pre-moisten my cotton tips. You can place them over here so they don't fall. And I do want to take out at least 2 pieces of gauze to have available that I'm also going to just kind of pre-moisten in my saline as well, just so they are accessible to me. Okay. The rest I'm going to use for drying, and then I do have my trach ties in there. So again, my patient is stable here because we've suctioned them. So I'm going to be trying to place their trach collar off to the side. Typically, again, I would leave it kind of about out here. However, on this patient, it's very, very tight. So I'm going to try my best here. See if I can move this off to the side for us. And I'm going to take my, again, dirty hand now is going to take out the inner cannula. And again, on a normal client, your trachea does go downward and not upward. However, on our mannequins, that's not the case. I can dispose of this again in the appropriate receptacle. I'm going to take my, I'm going to touch only what is the outside here. Because again, the outside is not going to be sterile, but if I were to ever touch this part, it would have to be with a sterile hand. But since I know my hand is going to come close to touching my patient, I want to make sure I can keep this hand sterile. Okay, so again, you follow the groove of like the trachea, that angle, and I make sure that it clicks in place, which it did. So perfect. So now I'm going to be starting my cleaning. So I will be grabbing my pre-soaked. Make sure that stays up for yourself there though. And I'm going to be coming as best as I can. I'm going to be doing a circular motion with my little cotton tip on the upper half. So again, and I'm always assessing that stoma for any signs of like irritation or redness. So I did one wipe up there. Grab this one. Again, this should be a little bit further out. My tie is just a little bit tight. You can always displace this slightly so you can do your wipe on the stoma underneath and kind of that circular motion. Make sure again your hands stay above your waist like your little T-Rex arms. You can also grab a piece of gauze over here that is moistened with the saline. It's all stuck together nicely. Rip off any excess there. What I would like to do is just, again, if I still needed to wipe, I could also wipe under that face plate, which would be this part to kind of cleanse and then dry. I also want to make sure that I am cleaning like that top of the face plate. So sorry, patient, but my hand is slightly in your face. So again, one gauze to wipe out there. Toss. I'm going to take this. My other gauze, and you can kind of manipulate it in a way so that your fingers aren't really touching that patient too much there. And you can again wipe on the other side of that face plate. And then now I just want to make sure I dry any surfaces that I moistened, because you don't want to leave. Put that within your box. Everything likes to stick together when you don't want it to stick together. Okay. So again, I can make sure to wipe under, or in this case, I'm just going to wipe on the top of that face plate. I'm also going to do this one. And again, you can also have like a little like trash thing here for yourself as well. Just wiping. I do happen to have one just below me over here. And now I'm going to take my sterile hand. Is going to take the split 4x4 gauze. Again, you should never cut these yourself. They're always going to be the pre-cut. And then all I'm going to do is kind of lift the phalanges here, and I'm going to be placing it underneath. Oops, this is all very tight. So I'm placing that underneath. I'm going to pull this up a little bit for myself here, and I want to lift. Again, unfortunately. So now that's already there. My patient's chin is just not very movable here. Okay. So again, you don't want to try to like displace anything with the trach itself. You want to keep that in place. Now, this is not going to be anything that I'm sterile with or anything like that. We're going to be removing the trach ties after I put the new trach ties on. So I can give my patient back their oxygen at this point as I am trying to work with the trach ties. As you can see, the patient already has really nice foam trach ties on, which are kind of more commonly seen. However, the ones we have in our kits are the string ones. So all you're doing is looping that through. I'm going to bring this behind my patient's head. Oops. Okay. And then I'm just going to go through this part right here. I'm going to loop it through, and we would do our tie. the key here is that you never want to take off your old ones until your new ones are on. I feel like my fingers are a little bit too big here to get this through. Oh my goodness. Almost. Sorry. Oh, a little bit of a workout. Okay. So you do want to do your tie. It just talks about like a square knot. Make sure again that you can fit about 2 fingers because you don't want it too tight. And at that point, you can take off your old ties. Okay, I'm gonna lift your head up, patient. Because again, they are secured before I'm ever removing. Okay, this is all still good. I can dispose of this. I'm going to take this off and dispose of it appropriately. All this I'm going to dispose of. All right, and again, I'm evaluating my patient. The SpO2 is still within normal range. My respirations are unlabored. They are within normal range. I'm going to take off my gloves. I am going to untie my back here. I can. Right. I'm going to snap that because untie that. And as soon as I untie it in the back, this is when you have to kind of shimmy out of your stuff, making sure that you don't touch anything that was on the outside. Roll that up. And then I would take off my mask glass, do my hand hygiene. At this point, I want to just discard all my equipment, as I said, reevaluate my patient, make sure again that their oxygen is at the appropriately ordered level. My suction is off. I'm going to raise your side rail up. I'm going to be lowering you to that lowest position, making sure that your collate is within reach and your bed is locked. I've done my hand hygiene before touching your bed. And I will leave your head at about at that semi-Fowler's or Fowler's position, just again to, since you have your tracheostomy. Okay, and so you do have your collate. Please let me know if there's anything I can get for you. Thank you. Hand hygiene.